Primary percutaneous coronary intervention for acute myocardial infarction with ST segment elevation. Under normal circumstances, the flow of oxygenated blood to the myocardium in the coronary arteries is unimpeded. As a result, the oxygen demands of the heart muscle perfused by the artery are met by an appropriate oxygen supply. In this drawing, the myocardium on the anterior wall of the left ventricle is perfused normally by the left coronary artery. The electrocardiogram reflecting that area of myocardium is normal. Over time, an atherosclerotic plaque develops in the coronary artery. For reasons that are not well understood, the layer of endothelial cells covering the plaque, the so-called fibrous cap, may rupture, thereby becoming a nidus for thrombus formation. Within minutes, an occlusive thrombus forms. Blood flow in the coronary artery ceases, and all the myocardium supplied by the artery becomes ischemic. This is reflected on the electrocardiogram as ST segment elevation. If the ischemia is unrelieved, all the ischemic myocardium will die within a few hours. The objective of balloon angioplasty and stent placement is to restore blood flow in the occluded coronary artery as quickly as possible, thereby preventing ischemic myocardium from dying. During balloon angioplasty, a thin metal guide wire is advanced into the occluded coronary artery and past the occlusive thrombus, after which a deflated balloon catheter is advanced over the wire, positioned at the site of the occlusion, and inflated for 1 to 3 minutes. Then the balloon is deflated and retracted. Coronary arterial blood flow is restored, thereby relieving the ischemia. As a result, the ST segment elevation begins to resolve. Alternatively, blood flow in the occluded coronary artery may be restored by the placement of a metal stent. A thin metal guide wire is advanced into the occluded coronary artery and past the occlusive thrombus, after which a deflated balloon catheter with a metal stent affixed to it is advanced over the wire, positioned at the site of occlusion, and inflated for 1 to 3 minutes. Inflation of the balloon expands the stent. The balloon is then deflated and retracted. The now expanded metal stent remains in place. Coronary arterial blood flow is restored, thereby relieving the ischemia. The ST segment elevation begins to resolve.